Hello and welcome to DIY Therapy. As always, we'll start with our disclaimer. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. My name is Will. With me as always is Andy, and hopefully you can speak better than I can.
Why, you having trouble today? You stroking out?
Maybe? I smell chocolate. My left arm hurts. Is this normal?
Tooth hurts? Yeah, you're going down. Should we call 911?
Just wait till you can't see me anymore and then call.
When you drop out of the screen?
Yeah, I'll be fine.
Okay.
Fine. You just, right. Once I stop talking and you hear a big thud, then maybe wait 10 more minutes and then call.
Why 10 minutes? Just to make sure that you do pass away, or what? What's the theory behind that? Yeah, because of where I'm located, you're gonna have to call a different, rather than the closest EMT, it's gonna be the farthest EMT. This is the way the cities work. Oh, definitely our city.
Yes, exactly.
All right. So how are we doing today?
Pretty good.
Besides the slurred speech.
The slurred speech, pretty good. Just celebrating a little bit of Valentine's Day.
Yes.
Did you get your wife anything?
What's
house.
That?
You got her a house.
Yeah, well, yeah, that's going to be for the entire year. Yeah, that's kind of my out for everything at this point. Hey, what'd you get for your wife for Christmas? Oh, we got her a house. Yeah. Oh, what'd you get her for her birthday? Oh, yeah, there was a house that we got. oh, Mother's Day. Again, house. Yeah.
Nice.
Yeah, that's what she's getting.
That's a good.
And then we got cabinets painted and all that kind of stuff. I mean, it just keeps adding up. So.
That's a good present. Yeah. The gift that keeps on giving, Clark.
Yeah. No, I was just ecstatic that I bought a card in advance, which I never really do, and I hit it. And then last night I was scrambling,
you forgot where you put it.
I wouldn't be able to make a good excuse of, hey, why are you going out of the house at 9:30 at night, on the day before Valentine's Day. So last night my wife heads up to bed, and I'm like, I gotta find this card. I have no idea where I put it. So I'm scrambling for 20 minutes and finally found it. So I was just ecstatic about that, which leads me to say, why do I ever actually be more prepared? The most prepared I've actually been in, probably a decade, all of a sudden leads me to almost not have a card. So, yeah, it's ironic, right?
Yeah.
So, all right, what are we talking about today?
Traction a little bit, and maybe some aquatic therapy.
Oh, we're talking about traction?
I don't know. We don't have to. What do you want to talk about?
Did we talk about that?
Did
we talk about that yesterday?
We mentioned it. We can talk about aquatic therapy.
Well, just all right.
Let's start with how it relates to kind of traction.
We did have this conversation. I think I was half paying attention.
Shocking.
It almost made me spit up my water. Yeah.
I don't know how either one of us have a conversation when neither one of us pay attention to the other one.
No. In fact, I'm surprised we're such good communicators actually when we are with our patients too.
Yeah.
Because that's the one time where I'm actually devoted to people. Other than that, I'm juggling 3 different things in my head, secondary to my ADHD. All right. So we'll start off with a little aquatic therapy.
Sure.
Now you have a lot more experience with aquatic therapy than I do. I mean, you actually did some time working in a pool.
Yeah.
How much time did you spend?
I was probably in it for a couple of years, and we were in. So it would be the way the clinic I was set up at. They did it. You're down there for I was down there 2 days a week, and for almost the whole afternoon.
By the way, let me interject here for a second, because the way that you described that at first was you were in prison. I was in it for 2 years, probably about 2 years. I did a 2-year stint.
Well,
yeah,
it was in the basement of the building, and so it was kind of like being in prison, sort of. I mean, one funny story I can tell you is, all of a sudden we were all doing the therapy, and all of a sudden the fire alarm goes off, which in an enclosed space where there's water is super loud. 1, 2. This is in the middle of winter. We're supposed to. The protocol is to just get up and go. not go get your clothes, not dry off, right? Just go out.
Towel?
No, I mean we had our towels like right there, so you could grab the towel, but that would not have been enough. And so we're like,
not in the middle of winter, right?
No, the other therapist I was with were like, let's just see what everybody else is doing.
Let's wait this one out.
Let's wait this one out. It was a false alarm, but it was still.
Let's see if this is legit. You know, when the rafters start burning and falling into the pool, that's when we'll start evacuating.
Water's not safe in a.
I don't know. I have a feeling smoke inhalation would be an issue for you at some point.
Not if you're underwater.
Wow. All right, so you want to give advice on this stuff, huh? After that comment?
I didn't say I was an expert.
All right. Fire away there, buddy.
So most of the time people got into aquatic therapy, as we would call it. Most people just call it water therapy.
Mm-hmm.
Is they were in so much pain they were unable to tolerate exercises on the land. And due to the buoyancy properties of water, obviously when you get into water, when you're standing in water, it reduces how much weight is on your joints. You're able to do a lot more. So we did a lot of kind of core exercises, just a lot of hip exercises. And then depending on the patient, if they were had some back pain, sometimes we'd let them what we call dangle, basically. So you just give them a couple of noodles, put some.
What's a noodle? What's a noodle?
A floaty?
Flotation noodle.
A flotation noodle, yeah, I guess.
Hang on to.
Yeah, something you can put under their arms. Some therapists like to put it on. There was a therapist I knew who liked to make those patients straddle it like a horse.
Okay.
Yeah, but anyway, I didn't do it that way because no patient ever really liked it, so I was like, whatever. And then you'd either put some weights on there to increase the traction, the pull on their spine, or you just let them kind of hang there like that for a couple, while you're kind of finishing, you start your other patient. And they can just hang there however long. Most patients, while they're in the water, were able to do quite a bit, and they would usually talk to me that, every time they come in, they'd say, oh, I love the water. They're able to do a lot more, and it would last for about an hour afterwards, and they'd go right back to being where they were. So water is good in a way, but it doesn't really translate very well into like real world non-aquatic stuff.
Yeah, it's interesting. I've been at the current place that we've had that we both work at now for about 3 years now, and the way that I used to evaluate patients for aquatic therapy was basically the doctor would send in an order and say, hey, we want this patient for aquatic therapy. And then I would go ahead and do the evaluation, send them to the pool, and then I would never see them again. In the last 3 years or so, we have actually, the way the protocol is set up at the new facility that I work at is that the patient is then just sent back to us for kind of a recheck and kind of to tie up the entire session and episode of care. And so it's been interesting because I've been able to actually get the last few years, a little bit of feedback on it. And the one thing I would say about this is, there are patients that I think you are exactly correct on. Like sometimes, people get a little bit of benefit from being in the pool. They're able to, weight bear a little bit more through the joints. They're able to move a little bit more through the joints, the painful joints. And some people do have some success with that because it does allow them to have everything. Podcast is, one of the things when we're in chronic pain is we want to create these moments where we can have this freedom of movement, right? Where we have, where we can start to load the joint, load the structures, do it in such a manner that isn't creating pain or going past that pain threshold. And if we can continually kind of, create input like that doesn't have a negative effect on the brain, then the brain can actually have a response of desensitizing the tissue, which allows the sensitivity and activity tolerance to decrease, or activity tolerance to increase, sensitivity to decrease. And so, I have seen some carryover more so than what I think I originally saw. I've been doing this 12, 13 years now, so just the past 3 years I've been seeing, being able to follow up with people. I think I've seen some better carryover in a certain classification of patients. I say that because the patients that then are transitioning to really small level exercises that help kind of bridge the gap from pool to land. The people that are doing some things on land to try to get them to tolerate more land while they're working in the pool are the ones that really do the best. So like individuals who I think will just do the pool therapy, not do anything outside of the land or the pool, and then all of a sudden expect to have, tremendous changes in their pain levels, after a 5-6 week stint in the pool and not doing anything on land at all, they're in for a poor, a poor outcome. They're going to be disappointed,
Yeah, and that's the way where we did it where I worked we did aquatic therapy. They did straight aquatic therapy for 5-6 weeks, and then they would either try to transition all on the land, and then so the transition was just too startling, I think, for a lot of them. Mm-hmm. Some of them would do fine, but it'd be like 50-50 on whether they would tolerate it well or not.
Yeah, and just another point on that. I mean, so sometimes like we're actually, and I can't speak to every state because we're in the state of Illinois. So in the state of Illinois, you can't do land therapy and you can't do aquatic therapy at the same time. And so, what I would encourage people to do is have an open conversation with your therapist, both your evaluating therapist and whoever's actually doing the aquatic therapy with you in the pool, and ask for home exercise programs that are nice transitional exercises to do outside of the pool, so that when they do get the opportunity to be done with pool, they're just not all of a sudden going from, hey, we're in this buoyancy dependent water situation where we're not loading the joints all together, and then all of a sudden we're loading the joints 100% again, And so if you can talk to your therapist and make sure that they're implementing, good quality home exercises even on land, I think you might have a better chance of having some better success, if that makes sense.
Yeah, and also a lot of times, provided the aquatic therapy that we do is not overly complicated.
No.
It's generally once you get it down, you can, provided you have access to it, and generally the therapy pool you get it at will have times that you can do it, and you can just do it on your own in supplementation with the land therapy that you're currently getting.
Mm-hmm. Yeah. Yeah, and again, I think that's where you have, maybe the best benefit for someone who's listening to this and is considering aquatic therapy is really having their thoughts and their plan, in their mind, their plan organized before going in and talking to their physical therapist. So you can ask, okay, so what's the plan after this? What's a transition like in this area? And, what are the resources that are available in this area? Are there open swims, quote unquote, open swims? Are there, do you have facilities that have, classes that you can attend and maybe pay for, or, monthly types of programs that you can get involved in afterwards? If they don't, okay, how are we going to transition to where I can tolerate, and introduce exercise in a land-based capacity versus really doing it in the pool? So
yeah.
So so just a quick rundown. People who I think can benefit from water therapy. People with really severe arthritic joints, specifically, and joints that are going to be load bearing. So like your ankles, knees, hips. A lot of different arthritic joints. So like if you've got like rheumatoid arthritis, or you've got osteoarthritis, just general joint degeneration. And you have a lot of widespread pain, multiple joints involved. Those people tend to do really well. Anybody who has then very high pain sensitivity, lots of pain, and very volatile pain, meaning that it doesn't take a whole heck of a lot to get the pain started. So these are all people who are really good candidates to trial aquatic therapy. See if you can get that sensitivity level down so that you can then, increase your activity in a land-based type program.
Yep, I would agree with that.
Yeah, and so I think I don't know. The warm water itself, there's therapeutic effects that can actually occur with just the warm water itself too. I think that's probably something worth, talking about. So the actual temperature, I think it's 92 degrees.
It's in the 90s. Usually every pool is a little bit different, but it's usually to be in a therapeutic pool, it usually has to be in the 90s.
Yeah, I think 93 and above is where you're doing more passive stuff, if I remember correctly, where if the temperature is 93 or above, basically you are being heated by the pool, so you want to do more things like dangling, or you want to do more relaxation type techniques. And then 92 and below, and you want to basically 92 to 90 degrees, you can do more physical stuff. So you want to make sure that your temperature in the pool that you're using is correct too. And I think just for reference, if I'm thinking about this correctly, 80 to 82 is your kind of standard just heated pool. Okay, so to really get those therapeutic effects, you're going to have to be about 10 to 8 degrees higher than that. So just getting into the pool in the summer is great. You may not get some of those heat therapeutic events, but you're still going to get some of that buoyancy type of
you can still do the exercises and whatnot.
Yeah.
Walking into the pool it's like getting into a giant tub. It's not quite a hot tub, but it's really warm.
That's it.
That's all I got. I can tell you the fact that I spent so much time in that pool. I spent so much time in that pool that
it's not quite like a hot tub, but it's really warm.
Well, yeah, and it makes you you have to pee so bad just because of the pressure. It is, you know how that is. And
oh yeah. Well, it's funny because we have Easter seals here in town, right? And I actually used to take Sam, my youngest one, into swimming class. And I would be sweating when I was done with that. I mean, yeah. I think that pool was 94, 95 degrees. And my little one at that point was, he was between 1 and 2. There was really no actual swimming. It was just me tossing him around and throwing him around in there. So I'm sweating after a 45-minute session of quote unquote swim lessons. And and he's just having a blast. So. Yeah, when it is in that 92 to 94 range, it is warm. Yeah. It is hot.
Well, that's all I really got about aquatic therapy.
Yeah, that's about all I got too. Why don't we could save another podcast for probably traction then, some of the benefits and some of the mechanics of the traction. I think if we went into that too much right now, we'd probably go way over.
Yeah, I agree with that.
Yeah. Anything else going on? Anything else exciting?
No.
Hey, we are about ready to launch our DIY therapy pain guide book, self-treatment guide. It's about 150 pages. It should be launched in the next couple of days, and it's the next series in our kind of treatment guides. We have a low back guide out there, so that's kind of exciting news. That's going to be launched, like I said, after last little bit of editing, and should be available to the public in the next couple of days.
Yeah, once it goes public, we'll put it in all the tweeters and on the gram and the Facebooks and.
Did you really just have all those little shortcuts for those things? Are you trying to be hip?
Isn't that what the kids do? I don't even know.
What do they? The gram? Is that a thing?
I only know that from the Lego movie.
And Tweeter versus Twitter?
Oh, that was just a misspoken thing, a legit.
Okay, gotcha.
That's
all right, wrap this thing up. We're done. We're rambling.
On that note, yes. This podcast was for educational purposes only. I don't know if anyone got educated on the end of that. It's not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment. Remember, treat yourself.